using antibiotics in the past few weeks. How would you feel if I tell you when you get sick, your antibiotics won't work? Antibiotic resistance is not just a problem in the US, but also throughout the world. I think I'm credible enough to talk on this topic because I've done research in the past few weeks on this topic. Also, I've seen firsthand antibiotic-resistant bacteria in the lab, right from the soil collected from Science Center courtyard. Today I'm going to talk about antibiotic resistance crisis, what causes it, and some of the solutions. Antibiotics kill pink bacteria when it goes through its outer layer and damages its cell boundaries. Purple bacteria are killed by antibiotics by damaging its cell boundary directly. So antibiotic resistance is when antibiotics are pumped out by the bacteria. And you see here the green circles, antibiotics bind to it, and that causes the problem for the bacteria. According to Center for Disease Control and Prevention, 2.8 million antibiotic-resistant cases are seen every year. That's like one person, either yourself in this room or your family, will get antibiotic-resistant just this year. Also, more than $4.6 billion is spent every year for healthcare costs related. That's over $12 from your taxes spent on this crisis. That can be prevented. So, what are some of the causes? Overusing and misusing antibiotics is a big problem, especially in livestock and hospital. This picture shows you antibiotic resistance, how it happens. Let's say somebody in this room had a viral disease, right? And somebody got confused that antibiotics treat viral disease. So what happens is, first we have a lot of germs. When antibiotics is injected, or when you take the antibiotics, it kills off the other bacteria and the drug-resistant bacteria dominates at the end. So now you're drug-resistant. So you just made yourself drug-resistant for no reason. According to National Institute of Allergy and Infectious Disease, more than half people have taken antibiotics unnecessarily. According to American Public Health Association, poll in 2017 done showed that 69% didn't know antibiotic resistance. Also, 53% people said antibiotics treat virus. This ignorance can lead to misusing antibiotics. According to an article by Ventulo Seeley, up to 90% of resistant bacteria from livestock are spread to human, either through exposure to manure or when we eat undercooked meat. Also, according to Ethereum Therapeutics, inpatient infection rate was much higher compared to outpatient rate. And that might be because hospitals often administer excessive antibiotics to patients, causing antibiotic resistance. So now that I've scared you enough of antibiotic resistance, how can we solve this problem? Antibiotic resistance may seem overwhelming, but it's not unsolvable. According to Down to Earth magazine, 10 to 58% success rate was achieved in South Africa when they took right measures. FDA right now has a 5-year plan recommendation, but it's just a recommendation, it's not illegal. So some people oppose that even after recommendation, there's no, we can't solve this problem because CDC's own research has shown that there's still a lot of resistant bacteria hanging around. But I disagree. Right now, we only have recommendations. We could implement laws that will limit the use of antibiotics. So I think implementing laws is really going to change this. Also, personal responsibilities. Wash your hands, practice good hygiene in order to control the spread of disease. Also, don't skip antibiotics or not complete your course, because that will also lead to antibiotic resistance. So, like I said, it may seem overwhelming when you hear antibiotic resistant crisis, but with right measures, we can control this. Today, I talked about what antibiotic resistant crisis was in the US and some of the causes and what solutions we can implement. I know a couple of you have taken Gen Bio, so take microbiology class with Dr. Coleman to learn more about it. To the entire class, next time you take antibiotics, be more mindful. Thank you.